Pill.
Dysmenorrhea, breaking down the pain. Hey everyone! Welcome back to our channel. Today, we're diving into a topic that affects many women around the world, dysmenorrhea, specifically primary dysmenorrhea, or PD for short. So, let's break it down together in a way that's easy to understand. First off, what exactly is dysmenorrhea? Well, it refers to the painful cramps that many women experience during their menstrual cycle. It's important to note that there are two types, primary dysmenorrhea and secondary dysmenorrhea. Today, we're focusing on primary dysmenorrhea, which occurs without any underlying medical condition. PD typically starts shortly after a girl's first period, known as menarche. The pain usually kicks in just before or right when menstruation begins and can last for a few days. It's estimated that between 20 to 90% of women experience this discomfort, and for some, it can be quite severe. Now, let's talk about the science behind it. The primary culprit behind the pain of PD is a group of chemicals called prostaglandins. These are hormone-like substances that play a key role in inflammation and pain. When menstruation begins, the body releases prostaglandins, which help the uterus contract to shed its lining. But, here's the catch, higher levels of prostaglandins can lead to stronger contractions, resulting in more intense pain. These contractions can cause ischemia, which is a fancy term for reduced blood flow to the uterus. This lack of blood flow can lead to more pain and discomfort. So, in essence, the higher the prostaglandin levels, the more intense the contractions, and the more pain a woman may experience. Transition to visuals of a doctor's office, with a doctor explaining to a patient. Now, you might be wondering, what are the common treatments for PD? Well, many women turn to non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen. These medications work by reducing the production of prostaglandins, which in turn helps alleviate the pain. Interestingly, many women are also exploring alternative treatments, including the herbal medicines. Some studies suggest that certain herbal remedies may help reduce pain by targeting the same pathways that prostaglandins do. It's also worth mentioning that lifestyle changes, stress management techniques, and even physical activity can play a significant role in managing dysmenorrhea. Practices like yoga and meditation can help reduce stress and improve overall well-being. Did you know that the prevalence of primary dysmenorrhea can range from 20% to a staggering 90% among women? That's a lot of us. And for about 15% of female adolescents, the pain can be severe. Now, when it comes to treating PD, many women turn to over-the-counter medications like NSAIDs. These work by reducing the production of prostaglandins, hormone-like substances that cause uterine contractions and, consequently, pain. However, NSAIDs aren't always effective for everyone and can have side effects. That's where herbal medicines come into play. Recent studies have shown that various herbal remedies can be effective in alleviating the symptoms of PD. For instance, some herbs have been found to inhibit uterine contractions and reduce pain through their anti-inflammatory properties. Let's break down some of the mechanisms at work here. Herbal medicines can help lower prostaglandin levels, which, as we mentioned, are responsible for those painful contractions. They may also suppress the expression of cyclooxygenase 2, an enzyme involved in inflammation. Plus, they can boost the activity of superoxide dismutase, an important antioxidant that protects our cells from damage. Interestingly, the benefits of herbal treatments don't stop there. They also seem to reduce levels of nitric oxide, a compound that can contribute to pain and inflammation. Some herbal remedies even stimulate somatostatin receptors, which can help modulate pain signals in our bodies. But it's important to remember that while herbal medicines show promise, they're not a one-size-fits-all solution. Every woman's body is different, and what works for one may not work for another. So, if you're considering herbal remedies, it's always a good idea to consult with a healthcare professional. In conclusion, primary dysmenorrhea is a common yet often misunderstood condition. While traditional treatments like NSAIDs and oral contraceptives are available, herbal medicines offer a potential alternative with fewer side effects. As we continue to explore the efficacy of these natural remedies, it's crucial to prioritize our health and well-being. Thanks for joining us today. If you found this video helpful, don't forget to give it a thumbs up and subscribe for more content on women's health. Remember, you're not alone in this, and there are options out there to help you manage your symptoms. Until next time, take care.
Pharma Pal.